Now we're going to talk about how we assess the thoracic spine or the middle back for misalignment or subluxation. And as we did with the neck, we're going to check some range of motion. Now again, with the thoracic spine, because we're dealing with the rib cage, there's not as great a degree of mobility in the mid-back as there would be in the neck or in the lower back. However, there is some range of motion, so we're going to go ahead and check that. So first we're going to have the patient go ahead and kind of roll their shoulders and back forward, and that's kind of how they would do flexion, and we're seeing how they do with that. We're going to have them arch back into extension, and then we're going to have them kind of twist and roll into rotation one side to the other. And again, with those ranges of motion, we're checking to see, especially with the rotation, again, if they can roll one side to the other as equally as they can, and if they're extending back or if they're rolling forward, again, if that causes any pain or discomfort for them. After we have checked those things and assessed for possible problems there, then what I'll have to do is have the patient lay face down so we can take part in palpation. Okay, and as we assess the thoracic or middle back for misalignment using palpation, we're going to look for some landmarks here to determine where the 12 vertebrae in the thoracic spine are. Typically, the first thoracic, or T1, is going to be a prominent point right here at the base of the neck, and if we feel up, we're going to see or find C7 here. So we have T1 here, and then there's 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. We can try to confirm that based upon feeling for the rib cage to see if we're feeling the ribs end about this area. And so then we're going to assess, again, typically I'm going to go down each level and just feel if there's a springiness or a flexibility from one segment to the next or over general areas to see how they're doing there. If we don't feel that springiness, again, that's going to be an area that's fixated. We can then check that area by feeling from one side to the other to see if we have a good range of motion or to which side it might be fixed, one side to the other. Additionally, because we are dealing with ribs, we can also check the different rib heads on the sides to see if there's an area where the rib head might be a little out of place or misaligned as well, because that can happen, and chiropractic can treat that as well. So then we're going to assess all these areas. We can also feel the musculature, the traps up here, the lats down here, just to see if there's trigger points or knots where it might also be restricting the flexibility or the mobility of the spine. And that is what we do in terms of assessing the middle back prior to getting it adjusted.